The human body consists of many different moving parts, including limbs which are supported by bones. Bones are attached to each other with connective tissues called ligaments. The mechanism used to move bone structures are the muscles. Muscles are attached by tendons to the bones which they move.
The system of bones and muscles may be represented as one of three different types of levers, depending on the position of the weight lifted, the fulcrum, and the muscle force applied to lift the weight. A Class 1 lever is demonstrated by a neck tilt, the chin lifted into the air with the neck a pivot point and the muscles of the back of the neck working to pull the back of the skull downwards. A Class 2 lever is demonstrated when the heels are raised. The whole body is lifted in this action, where the link between the toes and the sole of the foot acts as the fulcrum, and the calf muscles apply the force necessary to lift the body. A Class 3 lever is manifested as the bone and muscle system necessary to lift a dumbbell with the hand. The weight is the arm and dumbbell, the pivot is at the elbow, and the biceps muscles contract to move the weight upwards. The difference between a Class 2 and a Class 3 lever is that the position of the weight and the position of the applied force are swapped, with a Class 3 lever requiring more force to lift a weight a certain height than that position would be required to lift by a Class 2 lever. The names of the human bones in the human skeleton are as follows. The phalanges are located in the toes. The metatarsals are the bones in the foot closest to the toes. The tarsals are higher up the foot. The tibia is the large bone at the front of the leg, and the fibula is a smaller bone at the back of the leg, allowing the foot to turn to the left or to the right. The patella is a small bone located in the knee, and the femur is a large long bone in the upper leg, with a ball socket connecting it to the hips. The hips consist of a left and right coxar bone, and a bone between them called the sacrum, which connects to the vertebral column. Ribs branch off from the vertebral column and connect at the front of the body to the sternum. The clavicles at the front and the scapulars on the back of the body connect to the upper arm bone called the humerus. The lower arm consists of two bones called the ulna and radius, which allow the hands to be rotated in both directions. The bones closest to these bones are the hand, are the carpals, which are attached to the metacarpals, and the bones in the fingers are also called phalanges. The skull and mandible in the jaw are also bones. A muscle can contract to pull the bone it is attached via tendons to, or it can relax and allow gravity to change the position of the bone. Besides the influence of gravity, the movement of the different parts of the body are aided by antagonist muscle groups, which are attached by tendons to different parts of the same bone and allow these bones to be moved quickly in the opposite direction. These muscles also contract or relax, often as the opposing muscle is performing the opposite action. In the case of an exercise such as lifting a dumbbell with the arm, the biceps contract to move the weight upwards. The opposing muscles, the triceps at the back of the arm, are relaxed whilst this action is performed. The biceps are being used whilst contracting, and this is described as being concentric. As the dumbbell is lowered, provided the weight is lowered slower than gravity would normally enforce, the biceps are still being used to slow the effects of gravity, and this is called an eccentric bicep contraction. If the dumbbell were to be jerked down quicker than gravity allows, the triceps would be working and the biceps allowed to relax. Different exercises are generally described by the parts of the body moved and the muscles that perform the motion. Muscles are conditioned with use over extended periods of time to better perform the exercises. if the weight lifted by the muscle is increased during that time. In some exercises, many muscles are used. These are known as compound exercises. Examples of different exercises working the foot and lower leg include lifting the toes up and down. This works flexor muscles in the foot. An exercise called calf raise works the gastrocnemius muscle at the back of the leg. The tendon of the gastrocnemius is long and stretches to the bones at the bottom of the foot. It is called the Achilles tendon. The soleus is a muscle lying behind the gastrocnemius, and it may be activated when the knees are bent. Moving the foot upwards, using the tibialis anterior muscle on the front of the leg. On the upper leg, the hamstrings are a set of 3 muscles at the back of the leg, which will pull up the lower leg. Using a leg curl motion exercises these muscles. This can be done on a machine or in a kneeling position on the floor with one leg extended out and bending. The quadriceps are a group of 4 muscles at the front of the leg, which will straighten out the knee. Leg extension exercises done with a machine or an exercise known as the lunge makes use of the quadriceps muscles. The femur has 3 muscles attached between it and the pelvis, called adductors, which pull the leg inwards towards the midline of the body. An inner thigh lift can strengthen these muscles. The 3 gluteus muscles, maximus, medius, and minimus, and the tensor fasciae latae muscle in the leg are some of the muscles involved in the action of abduction of the leg. A side-lying leg lift activates these muscles. There are also muscles involved with the rotation of the leg at the thigh in both medial, foot towards the body, and lateral, foot away from the body directions. An exercise that targets the gluteus maximus muscle is the kneeling butt blaster, although the hamstrings also help in the extension motion. The muscles in the buttocks and the thighs are also able to be exercised with an exercise called the squat, which is performed with either a barbell held on the shoulders or with 2 dumbbells held by the sides of the hands. This is a compound exercise that will use many of the muscles in the lower legs and thighs to different degrees depending on how it is performed. Placing the legs further apart ensures different muscles are activated as the body is straightened out and lowered. Special care of the posture needs to be taken to ensure this exercise is performed correctly. The abdominal's main muscles are the rectus abdominis and the abdominal obliques. The rectus abdominis are 2 long muscles with tendinous inscriptions over the top of them, which through the skin give a segmented look. To exercise these muscles, equipment can be used while lifting the legs up towards the chest. This is called the captain's cradle. Other exercises can be performed on the floor called crunches, where the torso is lifted up the ground towards the abdomen. Alternatively, the lower half of the body can be lifted off the ground, crunching towards the abdomen. Initially, an exercise called the sit-up was prescribed to work the rectus abdominis, but it was found to more effectively work the psoas muscles in the thigh, and this can cause postural problems if too tight. The abdominal obliques may be exercised by twisting to the side during the crunch. The opposing muscle groups which straighten the torso are muscles in the lower back, with tendons connecting to the ribs and to the sacrum. These are referred to as erector spinae muscles. Muscles deeper inside the body may also aid in the motions. Back extension exercises can be done on the floor by lifting the arms and the legs, tightening the muscles, but using a blow-up ball is quite effective to view in detail the type of action performed. The upper back muscles include the latissimus dorsi, rhomboideus, and trapezius muscles. The latissimus dorsi muscle is attached by tendons to the upper end of the humerus bone at an insertion point called a tubercle, whereas the rhomboidus muscles are attached to the scapula. The trapezius muscles are on the right upper back, up near the neck, and are attached via tendons to the clavicle on the front of the body. These muscles are activated by performing rowing motions with the arms, whilst maintaining an appropriate pose such as in barbell or dumbbell rows. Pull-ups, where the arms are wide apart and hands have an overhand grip, and chin-ups where arms are close together and have an underhand grip, also effectively work the upper back muscles. There is a degree to which these compound exercises also work the muscles of the arm. The primary muscles in the chest are the pectoralis muscles. These can be exercised with chest flies, where the arms flex towards each other. The large muscle has many fibers which are more effectively worked at different angles. A bench press with a barbell or with dumbbells, or the push-ups exercise also work the pectoralis muscles, as well as the triceps and shoulder muscles. The shoulder muscles are the deltoids, which move the arms upwards, and 4 rotator cuff muscles, which rotate the arm within the shoulder joint. The deltoids are worked by raising the arms out to the side, to the front, or whilst bent over towards the back. The rotator cuffs are worked out by using weight in the hand whilst the humerus is rotated within the shoulder joint. The shoulders and the trapezius muscles can also be exercised by shrugging the shoulders whilst holding a barbell or dumbbells. Besides the biceps curl, the biceps can be worked out using a concentration curl, where the elbow uses the side of the knee as a support whilst the forearm is raised. A triceps kickback focuses on the opposing triceps group of muscles in the upper arm. The triceps can also be targeted by bench dips or with an exercise called the French press. The wrist may either extend, reflex, perform pronation or supination. Wrist curls with the hands in overhand or underhand grip, working against gravity, work the extensor and flexor muscles. A dumbbell with a weight on one side known as Thor's hammer can help to strengthen pronator and supinator muscles.
There are a lot of muscles in the body which are not mentioned in this video, and there are other exercises which can be used to target and strengthen those muscles which have been mentioned. A knowledge of these muscles and how they allow us to move will help us to better understand the way our body works and how we can improve our physical abilities.